Good evening, everyone, and welcome to today's continuing education about dry socket prevention and management in dental practice. I am very delighted to spend the next 1 hour discussing one of the most common yet challenging post extraction complications in clinical dentistry, the dry socket, and also known as alveolar osteitis. Before we begin, I would also like to thank Dental CE Academy for organizing this such a grateful and meaningful session tonight. Dr. Rawlings already provided a detailed overview about my profile, so I will skip this introduction to save time for us. This course has the following learning objectives. We will define clinical features and underlying the cause of dry socket following dental extractions. We will discuss the key risk factors and preventive strategies to minimize the incidence of dry socket. We will explain effective treatment approaches to manage dry socket and relieve patient discomfort. We will also identify practical steps for improving post-extraction care and patient instructions. And we will also recognize at the end of this presentation the role of natural rinses and how non-alcoholic mouthwashes in supporting healing and enhancing outcomes. This webinar is supported by H2Ocean LLC, and I am currently working as a Chief Scientific Officer to this company. Now, let's start with the topic right here. So, what exactly is dry socket? Dry socket is one of the most studied complications in dentistry. It is defined as a post-extraction socket that exhibits exposed bone either inside or around the alveolus that is not covered by a blood clot or healing epithelium several days after extraction. Clinically, the patient presents with intense radiating pain that often peaks between the second and fourth post-operative day. Several clinical studies and research has outlined this condition is not infectious in nature, it's a localized breakdown of normal healing. So during this presentation, we will hear this word healing multiple times because healing is the core fundamentals of dry socket. If we are able to have a healthy healing, we cannot have dry socket. So healing, we will constantly keep on focusing in this discussion. Now that we have defined dry socket, let's understand why it is so critical to address this condition effectively. So why should dry socket receive so much clinical attention? Because it's one of the leading causes of post-extraction pain and unplanned emergency visits. Studies emphasize that dry sockets affects not only the patient's comfort but the dental clinical efficiency as well. Each episode of dry socket occurrence means additional chair time, additional follow-ups, and potentially dissatisfaction among patients. And nowadays, in the world of social media and word-to-word kind of an advertisements or promotions, it matters a lot if we have a strong, good reputation among our patients while minimizing these kind of adverse effects. Our goal as a dental profession should be twofold. Number one is to minimize the occurrence of dry socket, and second, to manage it efficiently when it does occur. Now, let's review the key signs and symptoms that allow us to recognize dry socket early and manage it effectively. Let's look at the classical clinical presentation. Patient typically returns within 2 to 4 days of extraction, and they usually report severe pain radiating to ear, temple, or the jaw. On examination, the socket appears empty with exposed bone in 80% of cases, and sometimes we will notice a grayish necrotic layer. A clinical feature is the absence of pus or swallowing. If there is a no pus or no swelling, it means they wish distinguish itself from infection. It means there is no infection. Definitely, it's a clinical case of dry socket. Patient may also report foul odor, or an unpleasant taste. Systemic studies and reviews have emphasized that recognition of this clinical picture is key to early management of dry socket. Now, under the normal healing situations, the extraction socket progresses through four stages of healing. Number one is blood clot formation. Second is granulation tissue development. Third is epithelial migration and maturation. And fourth is bone remodeling. When this sequence is disrupted, we see alveolar osteitis. Multiple clinical studies have shown that maintaining that initial fibrin clot in the stage one of the healing process is the single most critical determinant for normal socket healing. Think of it as nature's bandage. Once removed prematurely, everything beneath becomes exposed. Once we know the normal sequence of healing, it's easier to identify when the process deviates. But it's also very essential to distinguish dry socket from other similar complications. In altogether, if you want to understand pathophysiology of dry socket in the simplest form of uh, understanding, once the tooth is extracted, there is a formation of blood clot in the extraction socket. And if there is a premature loss of blood clot, it leads to localized inflammation and the bone exposure. And this whole systematic process leads to delayed healing and increased pain. And this is what it's basically how the dry socket happens and what are the key components that are involved in the dry socket. Now, it is important to differentiate dry socket from other post-extraction complications. Number one, infection presents always with swelling, pus, and systemic signs such as fever. Osteomyelitis involves persistent bone pain and radiographic changes. That's a key feature. Sometimes retained root fragments, neuralgia, or referred pain from the adjacent teeth can also mimic dry socket. An accurate diagnosis, radiographic interpretations ensures appropriate intervention and avoid unnecessary antibiotic use. We have to be very cautious in using antibiotics. There are certain risk factors involved in the dry socket. Patient-related factors include smoking, hormonal influences, especially in the women, oral contraceptive use, and poor oral hygiene. Surgical factors include traumatic or prolonged extractions and limited irrigation during the extraction site. It will generate much more trauma as well as heat during the extraction. Systemic factors like diabetes or immunocompression situations can also delay healing. And of course, mandibular molars are the most common site for dry socket. A good preoperative risk assessment helps us prevent most cases before they even occur. Now, this is one of the good study I really want to showcase here. It's a good meta analysis of uses of smoking and tobacco. There's a 3 times more increase in the risk of dry socket if the patient is having smoking or chewing tobacco. So that we can understand threefold more risk of developing dry socket. Another risk factor is poor oral hygiene, and it's one of the major risk factor for dry socket. 44% of patients who reports to dry socket usually have poor oral hygiene. So what does this mean? From a clinical standpoint of understanding, it means the regular mouthwash is not working. The regular toothpaste is not working. Otherwise, why a patient have poor oral hygiene if the patient is doing rinse as well as doing toothbrushing on a regular basis? So there must be some deficiencies or chemical-based oral care products that is not providing the benefits which they should provide in order to maintain that kind of oral hygiene level. Smoking, oral hygiene, and traumatic dental extractions. These are the three key components which accounts for 90 to 95% of cases of dry socket. One or the another factor is always involved, and interestingly, these three factors can absolutely avoidable if we are diligent in our professional skills and if the patient is responsible and using the right type of oral care products which are natural, and those kind of oral care products that supports healing, that supports mineralization rather than harsh chemicals, dyes, alcohols, and colors. Another risk factor is that if a patient has a previous history of dry socket, so there are much more chances of prevalence of dry socket if the patient has an history of dry socket. So it's very important to take thorough historical examination of a patient before planning and scheduling them for extractions. And especially we have to be very, very diligent and careful about the operational procedures as well as the oral care products that that particular patient is using in order to maintain proper oral hygiene. Once diagnosed, the management is of the goal is symptom control and tissue protection. So, as I mentioned earlier, the ultimate goal of dry socket management is healing. Once we have a good healing, the socket will be covered and everything will be taken care of. So, pain control and symptom relief, both factors we are trying in order to achieve a good healing. So, irrigating the socket with gently with saline to remove debris, avoid curettage, which may delay healing. Placing a medicated dressing, we will discuss these. And most patients experience relief within 24 to 48 hours, with full healing occurs in 5 to 7 days if they are due taking care of their oral health. Uh, Another factor that really comes into the picture in the dry socket is delayed healing. And there are a lot of factors which is involved in delayed healing. One of the key factor is chemical based oral care products, alcohol based oral care products, because these products creates irritation, burning sensation, and disturbs the oral microbial flora. And when all these factors come together, it will delay the healing process, right? It will lower the oral mucosal immunity, and that's why the healing process gets affected. So it's very important to take care of healing process during the dry socket management. So let's understand step by step of management of dry socket. So start with a visual inspection and gentle irrigation with normal saline. Place a sterile gauze or dressing soaked in eugenol or iodoform paste if possible. Avoid gentle oral hygiene. Advise always to use gentle oral hygiene and warm saline. But nowadays, with recent advancement and new science coming up, the sea salt rinse proven to be much more beneficial in terms of initial gentle irrigation of the socket. Schedule follow-up visits every 2 days until the socket is epithelialized. A systemic review confirms that this conservative protocol yields excellent clinical outcomes. So we have to be very careful in doing these initial steps. Commonly used dressings include zinc oxide, eugenol paste, or honey-based alternatives. People are experimenting nowadays. Analgesics remains the mainstay for pain control, while antibiotics should be used selectively. I mean, misuse of overuse of antibiotics leading to a lot of complications. And even recently, ADA have listed the guidelines when to use antibiotics, specifically because overuse of antibiotics lead to C. difficile and so many other complications. And that accounts to almost 30,000 deaths annually solely in the US. Almost like 80% die due to C. difficile infection every day in the US. So it is very important to use antibiotics very cautiously, and if required, amoxicillin is the choice of drug, followed by clindamycin if the person is allergic to amoxicillin, and then comes the other options like metronidazole or azithromycin. New research is also exploring bioactive gels and ozone-based therapies for enhancing healing during the dry socket management. So there's a couple of studies that mention that prophylactic antibiotics can be considered in a very diligent way. It is very important to understand when to prescribe antibiotics. It is not necessary that we have to, prescribe antibiotics every time when we are dealing with extraction, whether the patient is immunocompromised, what are his what are his personal habits like smoking, chewing tobacco, alcohol, and what kind of oral care products that person use, right? And how the person responds to the instructions given by dental professionals. So all these factors plays a very major role at the when and when not to advise antibiotics to the patient. Other innovative areas is the use of ozone-based gels. 2021 clinical trial published in the journal called Gels. Ozone therapy helps reduce microbial activity and enhance local oxygenation that accelerates the healing process. This aligns with our ongoing move towards biocompatible chemical-free interventions. Nowadays, new studies have mentioned that sea salt based mouthwash and sea salt based oral care products provides a lot of micronutrients and elements that nourishes the healing cells and accelerate the healing process, and all together enhance the process of epithelialization. So all these new sciences is emerging nowadays, and definitely probiotics comes to the picture, but probiotics only works with natural mouthwash, natural oral care products. So if a person is using probiotic lozenges or localized application of probiotics, but rinsing the mouth with alcohol, it will not work because it will kill all the good and the bad bacteria. So it's very important to choose the right type of oral care products, because the oral care products definitely will turn the dimensions of healing process, whether it's going to be healed well or it's going to heal bad. So another factor now considered is PRP based, management in dry socket. But still, it's a lot of research is there. But still, we try to manage those things in conservative way as much as possible. Now, one of the thing is that traditional mouthwash and regular oral care products are not the best choice for the dry mouth. They cause much more harm than benefits. The traditional mouthwashes often contain alcohol, dyes, sulfates, parabens, and artificial flavors. These ingredients can irritate the soft tissue, delay the clot formation, and worsen the discomfort. For a healing socket, we need products that cleanse the oral cavity, that cleanse the healing wound without stripping away protective layers, without disturbing the healing process, without irritating the cells, without irritating the tissue, without any burning sensation. And that's where the natural alcohol free alternative becomes very much essential as part of your selecting the oral care products for the dry socket management. So there is science that reports that the chlorhexidine based mouthwash disturbs the oral microbiome. So, and we know that oral microbiome plays a very critical role in dry socket. When there's an excessive presence of pathogenic bacteria such as Fusobacterium nucleatum, then there are more chances of getting dry socket. This is one of the key pathogen. But also, the good bacteria are killed by the alcohol-based mouthwash. That's why they are not good option during the dry socket. Now, there's another study that mentioned that all publications are recently published. This is a very recent published article in 2025, and this study correlates that there are functional changes in the oral microbiota when tooth extraction happens. And that's why the alcohol-based mouthwash is not recommended because it disturbs the oral microflora, disturbs the oral microbiome. And that's why we definitely required patient to maintain a healthy oral microflora because healthy oral microflora naturally suppress the bad bacteria and maintain a good healing process after the tooth extraction. Also, there are studies that mention that over-the-counter mouthwashes increases the risk of pre-diabetes because they contains a lot of sugar inside them. So that's also very bad for the healing perspective. There's another study that mentioned that if there are certain comorbidities such as diabetic, if the patient is diabetic, hypertensive, and smokers, there is likelihood of four times more chances of getting dry socket as compared to a normal healthy person without any systemic conditions. There's an very good online resource called Healthline, and they mentioned that how to take care of extraction socket after tooth extraction, and they mentioned that I have highlighted that. I believe you will able to read this. Don't drink alcohol or use alcohol-based mouthwash for 24 hours after surgery. So all the independent health line guidelines recommends patients not to use alcohol-based mouthwash after 24 hours of surgery. So how a patient will maintain its oral hygiene if they are not able to use alcohol-based mouthwash because most and majority of the scientific data, health professional, medical professionals, and dentists now recognized as these alcohol-based, colorful yellow, green, blue, red, orange mouthwash are full of chemicals and they are not good for oral microflora. They disturb the oral microflora, and that's why it disturbs the healing process. Our end goal is to have a healthy healing. And in order to have a healthy healing, we want to keep the cells calm. We want to keep the cells full of nutrients so that they heal faster and they have better epithelialization, better protective layer. Many products have chemicals like colors like red 40, which is now banned by the government recently. So we have to consider these chemicals as very awful in terms of, for putting inside our body. It's a recently done study, and it is also published in 2023 that indicates that the products in the oral care market right now, ingredients are not so safe. They have very, very large amount of adverse effects, and various serious complications of using them. And one of them is delayed healing. And with delayed healing, we will have conditions such as dry socket. So this is also one of the interesting studies recently published. So if everything is bad, now the question comes, where is the solution? Everything is bad. We cannot use any mouthwash. Where is the solution? Recently, we discovered that, solutions is present in the nature itself. We have to just become more diligent in recognizing those solutions. Sea salt. Sea salt has been long recognized as a natural oral healing agent. It provides a gentle antiseptic environment, maintains tissue moisture, and reduces the bacterial load. Studies demonstrated that sea salt rinse significantly improves healing outcomes and compared to the alcohol-based mouthwash. Even for chemo-mouth patients, mucositis, or surgical recovery, salt water remains the safest and the most universally accepted option. Even from our generation and generation from grandma's recipe, everyone said that, have a warm saline rinse. But with new technology, with new science, now we have much more higher version of premium amount of normal saline. Now, why sea salt is an effective option? It is why it is safe option because it is gentle and safe formulation. Sea salt based products are free from any artificial colors, alcohols, dyes, chemicals, sugar, preservative, ensuring that they are gentle and non-irritating to the sensitive oral tissues, especially at the time of healing, post-surgical care, after extraction, or after dental implants. It promotes healing. The natural minerals found in the sea salt supports tissue regeneration and wound healing, making it an effective choice for maintaining healthy and calm oral environment. They are also mineral rich. They contains lot of mineral inside them. Around 80 plus minerals you can find in a sea salt, in a premium grade unrefined sea salt, such as sea salt from the Red Sea. You will have those kind of minerals available to the cells rather than the chemical and alcohol. Also, sea salt being hypertonic in nature, it will draws out the excessive fluids from the inflamed tissue and reducing the swelling and promotes a balanced environment. It also maintains a natural pH, something around 6.5 and 6, which is the optimal pH for enamel remineralization. It is a natural antibiotic as well. So, for example, sodium chloride present in the sea salt dries out the harmful bacteria and curbs infection. Magnesium present in the sea salt fights inflammation and supports healing. Calcium present in the sea salt fortifies epithelial cell integrity. Potassium helps maintain moisture and protect against irritation. Zinc provides antimicrobial protection and speeds tissue recovery. These mineral synergy altogether make sea salt based products an excellent choice for patients with oral sensitivity, surgical recovery, periimplantitis, tooth extraction, wisdom tooth extraction, offering both comfort as well as clinical benefits. It is also the best choice for the patients who are dealing with, cancer recovery. Cancer survivors, the number one remedy for managing the oral side effects is sea salt based oral rinse. Highly mineralized, very much effective, and very gentle for the oral care. There's a lot of independent websites, health guidelines, health lines, news reports that mention that salt water works efficiently. It has been used for gargling for centuries and centuries before and helps the oral health. So these are all independent resources and news reportings. The another interesting fact, and it is the recently published study in back in 5 6 years, where they mentioned that the rinsing with saline, normal saline can promote human gingival fibroblast wound healing growth. So if a normal saline can produce that kind of growth that has only two elements, sodium and chloride, so imagine a kind of a growth we can have when we are using the sea salt based rinse in terms of the gingival fibroblast growth. Also, sea salt has been, associated with its anti-inflammatory effect. It's a mineral rich, so there's a lot of science, lot of research, lot of studies behind it. But please remember that all salts are not equal. This is the key of understanding it. How you understand the salt. which salt is the best for the oral care, what is the mineral content of the salt, especially the sea salt, how the salt is harvested, how is the salt processed, what is the purity level of the salt, what is the salt to water ratio. So all these components make it very, important component while we formulate a very, clinically effective salt rinse. Sea salt from the Red Sea is the nature's best sea salt. Why so? Because it is unrefined, hand harvested, and it contains 82 plus minerals. No other sea salt has so much minerals which you can find from the sea salt. There's a recently published study, and it is published in 2015 and 2016, that mentioned that deficiency or excessive of trace elements can also implement to oral, health systemic conditions. So that is why the sea salt comes into the picture, because there's a right balance. We don't need under nutrients, we don't need over nutrients. So we have to maintain that kind of balance. And nature maintains that kind of balance in the ocean. And that's why sea salt is very critical in terms of balancing these nutrients for the best synergy and for the best results. Also, we have to understand that regular salt rinse is very weak. When we say that salt rinse, normal saline rinse, people think that do it yourself by in home by mixing salt, table salt with water. It doesn't work. Why? There's a reason behind that. It doesn't. It The normal table salt has only two elements as compared to the sea salt from the Red Sea that has 80 plus or 82 plus minerals. I mean, it is sea salt from the Red Sea is not chemically refined and processed. It is not heated to extreme temperature. It's always organically harvested as compared to the table salt. And it doesn't have any environmental impact as compared to the sodium chloride table salt that is produced in mass production in factories, and it's much more a commercialization process. So there's a lot of research and studies. I mean, I'm just, highlighting those studies. I don't think I have so much time that I can go into deep into that, but I have all the references attached to all these studies, how the sea salt has therapeutic properties, wound healing properties, anti-cancer effects, headache neck cancer treatment, induced mucosal toxicity managing effects. It can help in prevent dental caries. So, oral microbial colonization, alveolar osteitis, we are just discussing it. So, early in preventing early life parental disease infections. So, there's a lot of ways where sea salt is proving scientifically in a great spheres of managing the oral health. Salt recommendation has been the number one choice for even for the cancer survivors. I mean, we are in terms when we say cancer survivors comes to the population from the time a cancer is diagnosed throughout the lifetime of a person. So all the big major hospitals, cancer research institutes all over the world, including the US, recommends salt rinse for mucositis. But what about what kind of salt rinse? Table salt doesn't work effectively. So when you use a sea salt based premium scientifically formulated sea salt from the Red Sea, it can give tremendous results, and the cancer survivors get benefited from that. Now, this is one of the interesting research paper that I highlighted that one randomized clinical trial suggests that warm saline rinse used following extraction reduce the risk of dry socket post-operatively. So now imagine that a warm saline rinse, and saline rinse is just sodium and chloride, two elements. And when you use sea salt from Red Sea that has 82 plus elements, now imagine a kind of benefits that can be achieved from that kind of saline rinse. So there's a huge potential, there's a huge science that can really make a difference in the life of a patient who is undergoing uh, extraction for his or her wisdom teeth. Lot of studies are there that mention that how sea salt based mouthwash can prevent xerostomia. It can help enhance the healing process even in the diabetic patients after surgery. So that's a diabetic patients are hard to heal. There's a four times chances of getting dry socket, but they have a better results when they use sea salt based mouthwash. They improve the oral hygiene among adolescent population. So it works on the all age group from younger age to the older age groups as well. And there's also a randomized clinical trial that mentioned that, uh, when they compare evaluation of sea salt rinse with alcohol-based mouthwash, they have almost equal or superior results. So why we want to use an alcohol, chemical, colors, preservative-based mouthwash when we have a simplest solution that is equivalent or even much more better to that kind of oral care products. So with this, I want to end my presentation with a few takeaways for you. Always identify the early signs of dry socket as soon as possible, especially related to radiating pain, you know, differential diagnosis it from the infection with taking care of swelling and pus, and prompt reply and prompt prevention strategies really works well. Provides patients an easy to use oral hygiene instructions so that they can, very well take care of their oral health, especially in this world of digitalization, uses of SMS, emails, social media to educate and engage with the patients. Preventive practices and protocol, pre-operative prevention, always take an historical profile and charting of the patient very thoroughly. Always analyze the risk factor before putting the patient into the chair. Intraoperative prevention, controlled surgical operations. I mean, try to minimize the surgical operation site as early as possible. Don't over expose the bone. Don't over enhance the surgical practices in the site with limited irrigation, and even try to do irrigation with sea salt rinse rather than saline irrigation, normal saline irrigation, because it can produce much more results. And post-operatively used sea salt-based saline solution in order to maintaining a good oral health. Recommend, natural oral care products to the patients that are gentle, non-irritating, and free from harsh chemicals. Our ultimate goal is to educate the patients to use the right products that should not disturb the healing process and does not, you know, do more bad than good things. So that's very important. Salt rinses is the key to move forward, considering a lot of science, research, and education that's coming up. Best mouthwash to prevent dry socket. Many people ask me. I mean, if you have a mouthwash that has a combination of sea salt, lysozyme, kind of a natural antibacterial, as well as xylitol, all these together work synergistically in a beautiful way in order to provide all those kind of therapeutic effects which is required for an healing cell, for an healing surgical site. And that's what we are looking for. With this, I, thank everyone for your all attention and engagement. I hope this session helps you translate scientific understanding into a daily clinical practice. If you'd like to explore much more detail, collaborate with me, want to involve with research on with me, or have a feedback, feel free to contact me. I am more than happy to answer questions here, as well as you can reach out to me over the LinkedIn, or you can even, just shoot an email to me and I will respond back to you as early as possible. So thank you everyone for being so much supportive during this presentation. Thank you. Hi, Dr. Rawlings. We can start with the question answers. Yes, I mean, I'm seeing some of the questions here. Let me respond as I am seeing over the screen, like, you know, mm, so I see a lot of question where it has been asked like, does it lead to any hypertension or diabetes? Experience any adverse effect related to sea salt based mouthwash that has brought to my knowledge about this condition. I am scrolling down to see much more questions if I can see. Hmm, I so
Dr. Saini, are you able to hear me?
yes, ma'am.
Okay, I was talking earlier. I don't think you were able to hear me, so I had to log out and log back in. Let me go ahead through these for you. The passcode will be given at the end of the course. We're still going through the Q&A. And I guess there are a few people that had frozen screen here.
Mhm.
Okay. What is the various differences between Himalayan salt, sea salt, Red Sea salt? What
So,
can you tell folks, Dr.
yeah,
Saini?
Himalayan salt, first of all, is not a sea salt. Himalayan salt is coming from Himalayan, that's a mountain in the Asian region touching to India and Southeast Asian countries. So it is not a sea salt. It is misinterpreted as a sea salt. And the difference between Himalayan salt and other sea salt is that in order to excavate those salt from the Himalayan rock or the mountain, we they usually use heavy machinery and that contains a lot of rust, and sometimes that gets intertwined with the salt they excavate with a high concentration of iron. So that's why it is not equivalent to a sea salt coming directly from the Red Sea, that is a natural environmental protected area, and it is one of the most unrefined hand harvested sea salt that contains 82 plus minerals.
Excellent. Thank you. What ages do you feel would be adequately served by using sea salt?
So sea salt is 100% safe. And consider like at what age you want to take your baby to the ocean. We take the babies from the 9 months, from 8 months till 80 years, 90 years, 100 years. So there is no limitation for going to ocean. Same, there is no limitation of age restriction using the sea salt based mouthwash or the sea salt based oral care product. So it's safe for all ages.
Scrolling up here, you have a lot of thank yous here. And go ahead and post your questions for Dr. Saini in the chat area, please. Dr. Saini, can you talk a little bit about the properties of lysozyme, why that's important again?
Yeah, lysozyme is one of the most natural antibacterial enzyme present in the human body. It is a part of our immune system. It is the enzyme which is found in various body fluids like your tears, saliva, and human milk and so on. So it's our natural defense. So if you have a lysozyme in your oral care product, so it means you are building the mucosal immunity, you are building the immunity inside your oral tissues and healing cells. And that's why it is very important if you have a lysozyme in their oral care products. It has a lot of role in immunity. It's a key component of the innate immune system.
What causes the pain in dry sockets?
I mean, Definitely, if your bone is get exposed and you have the bony exposure, it's one of the most common factor that's involved with pain, and also there's a lot of nerve endings that get exposed, and it basically related to exposed bones and nerves are highly sensitive that cause severe pain, and this pain is typically throbbing, sharp, and sometimes stabbing, you can say, radiating to ear, jaw, or even to the head. So that's one of the reason of severe pain.
Do you feel that the sea salt maintains the integrity of the oral microbiome for the most
Yes,
part?
yeah, because sea salt contains a lot of minerals, like 82 plus minerals and elements. So what does these minerals do? That they, first of all, they have a natural antibacterial property. So it will help maintain the oral infections at most natural way. Secondly, they do not disturb the oral microflora. Oral microbiome is one of the key things that is critical in maintaining the oral health. And that's why we don't want to get it disturbed with chemical alcohol dyes, all those kind of sugary and highly preservative based commercial oral care products. And that's why sea salt forms that kind of natural balance by giving all the key oral hygiene properties. And that's why it is very important to use natural mouthwashes, especially after you are dealing with wisdom tooth extraction and dental implants, cancer survivorship, and so on.
There are many sea salts on the market. Which one is your favorite?
So it's not about my favorite, it's about the which one works best for the human body systems. So out of all the sea salt from Red Sea is one of the most, what you can say, that the unrefined, hand harvested sea salt, and which is coming from the environmental protective region called the Red Sea in the Middle East, in near to Egypt. And that's why that kind of sea salt you will not find in grocery stores or in other regular stores in the US or beyond, because it has a limited supply, and it is maintained through a strict circulation channel, and that contains a lot of minerals, and that's why we recommend to use premium mineral rich unrefined sea salt, such as sea salt from the Red Sea is the best.
There are questions about where it is best to find the sea salt. I want to remind everyone, if you stay on after this presentation, there will be a presentation from the sponsor H2Ocean. It is not required for CE credit. We do have to make sure we inform you of that. If you do want to stay on, you'll learn more. Also, there's a code at the top of the screen, or I'm sorry, call to action banner if you'd like to claim a free sample. Still another question here. Is it only Red Sea salt or all sea salt that is harvested naturally?
Yes, sea salt from the Red Sea is harvested naturally. Yes, ma'am.
How do you make sea salt rinse?
Well, as I mentioned, do it yourself. The table salt rinse it's very weak. It doesn't work efficiently because it has only two elements, sodium and chloride. And also, you cannot maintain salt to water ratio, the quality of the water, what kind of salt you want to use. So I will personally doesn't recommend to use home-based saline rinse as part of your oral care. That's a kind of an old grandma style that's gone for years before. Now we have a science-driven, scientifically formulated, much more higher level of premium salt rinse, which is available packaged in the bottle, and with highest quantity of minerals, purity of the water, the right salt to water ratio. So definitely, I will say using the commercially available standardized salt rinse as part of your oral care.
Do you recommend chlorhexidine for mouth rinse?
I will not recommend it right now, considering when you have an equivalent or somehow better benefits by using salt rinse, which is a natural way of mineralization, protecting your oral health. So why you want to rely on a chemical-based solutions, and why you want to put chemicals inside your oral cavity and eventually into your whole body health system?
Is there iodine in sea salt?
Well, as I mentioned, sea salt contains each and every mineral. The beauty of sea salt is the concentration, how much of concentration is present in there. So it contains iodine, but in such a level that it will not have any adverse effect to your body. So that's why it has 82 minerals, and that is the difference between a table salt when sometimes people consider, oh, if I have to use sea salt based mouthwash, will it lead to hypertension? No, because the salt and the mineral content is very well balanced, equalized with 82 plus minerals. There is no specific mineral that dominates the rest of the minerals, and that's why I used to say that it is safe, even including the iodine.
Is it recommended to use the Red Sea salt 24 hours after extraction?
Oh, yes. I mean, definitely you can use after 8 hours of extraction. You can gently rinse it. You have not to be do a rigorous, gargling or squishing in your mouth, but definitely you can rinse it smoothly and gently, moves around your extraction site and then spit it out nicely and smoothly because it also contains lysozyme. It also contains xylitol if you are using some of the kind of mouthwash that's available in the market that contains all these components, then definitely it's going to help you heal better, gives a much more clinical outcome as compared to any other oral care alcohol based or chemical based mouthwash in the marketplace.
Do you still recommend zinc oxide eugenol paste for dry socket?
Yeah, I mean, yeah, sometimes it is recommended based on the type of the surgical site involved. Yes, we can use that.
Okay. More questions around ratio. Is it better to use sea salt for nasal saline rinse?
Yes, I mean there are companies that produce sea salt from the Red Sea based saline nasal rinse as well. So definitely they have a different line of products, so you can use those as well. So different product lines, but if you find sea salt from the Red Sea, and that's what you are looking for in terms of your product lines for the oral care or the nasal care, I think it will work wonderful.
How do you feel about crushed aspirin and eugenol mixed chairside?
Well, these are sometimes customized, surgical site management based on individual clinical expertise. So it's a custom-based, experience-based procedures that some dentists follow. So I can't say anything. It is not a standardized treatment protocol. So I mean, I will let this question pass by.
Another question, comment. Hey, Dr. Rajiv, enjoyed listening your webinar like all the times. What are the risk factors to be kept in mind for pre-operative evaluation for a dry socket?
Well, for the pre-operative operative prevention, the number one risk factor is to understand if the patient is having any systemic conditions like hypertension, diabetes, or cancer survivorship. This is the number one factor of understanding the patient profile. Second, to understand how the patient responds to your communication. Like, how do you think, how much do you think he will be or she will be responsive for maintaining the oral hygiene? And third factor is I really want to mention that, like, always try to understand what kind of oral care product the patient is using. For example, a patient has gone an traumatic or an atraumatic tooth extraction, depending upon the clinical efficiency of a dentist. Now, what will happen after 8 hours or 10 hours? The patient has definitely has to drink something, definitely has to eat something, maybe a soft diet, but the food remains in the socket. So the soup or the any protein shake the patient will take will move around to the socket. So how you will remove that? How the patient removes and clean it with regular water? It will serve a little bit of purpose, but not the total 100% oral hygiene. So it's very important to understand as a dental profession to recommend the right kind of oral care product. We do not want to disturb the healing process. Healing process is very delicate, very gentle. The healing tissue starts to build up. There's a multiple phases of healing process, and the first phase is the most important. That happens within 24 hours. We want to keep the healing socket as gentle, as non-irritating as possible so that the cells heals faster for a better epithelialization. And that's why if you are using the safe, mineral-rich products, it will not only maintain the oral hygiene, but also accelerates the healing process. And that is we want. Altogether, dry socket is nothing, but you have to maintain process, steps, and procedures to enhance the healthy healing process. So, healing is the ultimate outcome of any surgical site in the oral cavity.
I want to announce the passcode. It is 329571. 329571 is the passcode. It is also in the chat area. Please write it down and make sure that you have it in case you need to resubmit the quiz. Do you have an aftercare instruction sheet and how often to use the rinse?
Well, after an initial extraction, I will say wait for 4 hours, let the initial fibrinization process begins. And then after 4 hours, you can gently swish the mouthwash inside the oral cavity. Just move around the surgical site area and spit it very nicely, very smoothly. Don't do harsh, vigorous rinsing for the initial 24 hours. I will recommend to keep on using gently swishing the mouthwash inside the oral cavity, even to the surgical site, with as much gentle, swift movement as possible. The whole goal is to mineralize the surgical site as well as to kill any proliferating and infectious with the use of natural antibacterial enzymes such as lysozyme. So it is safe.
We're going to go ahead now. Dr. Saini, thank you so much for your presentation. Let's have Eddie's presentation play right now. And this is H2Ocean. We'll have it pick up again with the Q&A with Eddie Kolos and Dr. Saini. We'll have more questions here. So there are some. Again, this portion is promotional. And if you tap on the blue banner at the top of the screen, it will take you to information about H2Ocean. Thank you so much, Dr. Saini. Here we go.
Hi, I'm Eddie Kolos, the CEO and inventor of the first ever sea salt healthcare products. Today, I'm excited to introduce to you H2Ocean, a global leader of sea salt healthcare products since 2001, pioneering the use of sea salt-based products in healthcare. Over the years, we have developed more than 32 products across various categories, distributed both in the US and internationally. Our commitment to excellence has earned us awards for Entrepreneur of the Year and globally recognized. We are not just about business, but we're also deeply committed to ocean conservation. At the heart of every H2Ocean product is sea salt from the Red Sea, known as the world's most mineral-rich sea salt. This hand-harvested, unrefined sea salt contains over 82 trace minerals naturally aligned with the human saline system. This unique composition is what sets us apart from all the other products. We uphold the highest standard in quality in our production. Our products are patented, cruelty-free, and manufactured in an FDA-registered facility. We are committed to continuous innovation and development, ensuring that we stay at the forefront of sea salt healthcare. Now, let's focus on one of our flagship products here, the H2Ocean Healing Rinse, the world's first sea salt-based mouthwash. What makes this so special? The key ingredients: red sea salt, enriched with 82 trace minerals, hand-harvested, unrefined, and perfectly matching the human body saline system. Lysozyme, an antibacterial enzyme that enhances immune system's protective function. Xylitol, a natural sweetener, approved by the FDA and widely accepted in the dental industry for its oral health benefits. Our sea salt mouthwash offers excellent results in various oral health issues, including dry mouth, bad breath, post-extraction care, implant hygiene, and daily oral care. It is safe for all ages, including diabetics, and contains no alcohols or dyes, or any harsh preservatives like fluoride or added sugars. It's scientifically backing. H2Ocean's mouthwash isn't just a product, it's a scientifically proven solution. We conducted extensive studies on its effectiveness in treating gingivitis, dry mouth, dental caries, and for orthodontic hygiene. These studies have been published in reputable scientific journals. H2Ocean has become the #1 post-dental care mouthwash for surgery, orthodontics, and implants. We offer excellent patient compliance with our cleaning with healing approach. Our product comes in 2 natural flavors, the Arctic Ocean Mint and the Lemon Ice, in 3 different sizes to suit your various needs: the 64 ounce, the 16 ounce, and the 8 ounce. For dental professionals partnering with H2Ocean, we offer both clinical success and financial growth. We have 2 main partnership programs. A wholesale partnership. This program offers significant discounts, allowing partners to generate additional revenue. For example, our 8-ounce mouthwash bottles, we have a manufactured suggested retail price of $10, but they are available for our partners for just $5, offering a 50% profit margin. The affiliate program. This is a flexible, zero commitment program that allows partners to earn without any overhead costs or inventory hassles. It's a simple 4-step process to get started, and partners can potentially earn a minimum additional income of $13,000 annually based on referring 100 new patients each month. H2Ocean is more than just a product. It's a revolution in oral care. Our sea salt-based mouthwash offers unparalleled benefits backed by scientific research and trusted by customers and industry partners alike. We invite you to explore partnership opportunities with H2Ocean. Whether you're interested in the wholesale program or an affiliate program, we're here to support your success. Thank you for your time today. If you have any questions, please don't hesitate to contact us at info@h2ocean.com or call us at 772-219-8183. Together we can transform oral health care with the powers of sea salt. Thank you and enjoy.
Hello.
Eddie,
Thank you for having me again.
questions. Thank you, and thank you to H2Ocean for supporting the program this evening. Dr. Saini, this is a question that went back earlier. To be clear, you do not recommend Peridex mouth rinse post-operatively for dry socket for proper oral hygiene?
Well, my answer to that is that I recommend and I prefer to use a natural sea salt based mouthwash that can gives you right kind of minerals, nutrients. I do not want to comment on any other specific brand in general, whether that is good or bad. I just want to mention that you have to avoid all kind of alcohol, chemicals, dyes, colors, all those harmful preservatives that can be very detrimental to the oral microflora as well as disturbing the gentle healing process. What healing requires is nutrients. It requires a non-irritating environment inside the oral cavity that helps a better epithelialization process. And that's the goal of managing the dry socket.
Thank you. Is it safe to say that your rinse does not disrupt nitric oxide production in the body?
No, it is safe.
Is there a sea salt near Israel that is similar?
That's the Red Sea.
Okay. We've got a comment here, never use powdered ASA aspirin if you want to avoid a massive ulceration to the site. It's very acidic to the oral mucosa. Let's see here. Eddie, what ages are using your rinse?
All ages. I mean, I started this company when I had twins that were born, and I have a spray that I used for all their wounds and the mouthwash. I think all my employees that have new babies and young children are using our mouthwash and are absolutely in love with the flavors, and they are doing even videos on how they love it better than any of the chemical-based mouthwashes out there.
Can you talk a little bit about the ingredients again in your products, what you've included and what you've left out?
So there's like a zinc gluconate in there too that will help with bad breath. There is a lemon ice flavor, which has a high amounts of vitamin C, as you know, but not all lemons are the same. We source ours from one source place. All of our ingredients are also sourced from the same exact place because we started with the study work, and we don't want to change any of our formulas or any of our ingredients because of the outcomes that we're getting from the clinical studies that are published. And then we have an Arctic mint flavor, which is kind of like a spearmint or peppermint type. We call it the ice because we use a menthol crystal, which is different than just the regular menthol. It's like an extract, so we make sure that we take any of the impurities out of it. All of our ingredients are proven safe and effective. And then it's the very important factor of the lysozyme, the xylitol that we use, but the red sea salt that is unrefined. There's not any red sea salt in the marketplace to buy in the supermarkets. There's just not enough available for it to be used as a food table source type of salt. So we have agreements with the distributors that we just started telling everyone about the red sea salt probably only about 5 years ago, or even less than that. And, we're proud to actually say that our ingredients are sourced from the same organic sea salt based, which is surrounded by, protective oceans that are not polluted or have any kind of plastics or any kind of contaminants, toxics,
Thank you. Dr. Saini, another question here for you. What is your protocol after a patient has a dry socket?
So as I mentioned that careful clinical evaluation is the number one factor. You have to do a differential diagnosis and rule out if it is dry socket or it's infection, osteomyelitis, or a left out root spicule. First of all is to rule out. And then once you have able to understand that's a typical dry socket condition, then irrigate it. And now we can go a much more higher level. Rather than irrigating with normal saline, we can use sea salt based solution, in order to irrigate the socket, and then try to gently dress it up with the dressing. And then we will ask the patient, no, now painkillers, definitely we have to give non-steroid anti-inflammatory drugs, ibuprofen, etc., in order to mitigate the pain. And regarding the antibiotics, we have to be very careful selecting the antibiotics, and depending upon the situation of the case, we have to rule out to give or not to give an antibiotics. And then we will ask the patient to use, normal sea salt based mouthwash multiple times in a day, 5 times, 6 times a day. The whole process is to make the oral cavity more rich in nutrients, not only to accelerate the healing process, but also to make the environment much more conclusive for healing. And ultimate, as I mentioned earlier, the ultimate outcome for any surgical site in dental operatory is excellent healing outcomes. And that has to be managed and maintained. And in that particular cycle, the role of oral care product is very dominant. I mean, whatever surgical procedures you do, whatever clinical operations you perform in a dental chair, at the end of the day, the patient is left out with oral hygiene instructions and with the oral care products. So the type of oral care products will make it or break it.
Okay, thank you. Next question here. Can you swallow the rinse or must you spit it out?
Well, Eddie, go ahead.
Okay. Well, I swallow it every day, and actually, it's safe to swallow. All of the ingredients are food grade or USP grade. We don't recommend to take, a whole bottle down, but I did have a baby that was drinking the whole bottle at the early time of our development of our product back in like 2005. And I got a call in the middle of the night from the mother, and we just sat on the phone, talked about it. Nothing ever happened to the baby. She was fine. So that was great. And it also helps with like possibly like your gut. If you have like issues with diarrhea or throwing up, because I always recommend that too as well, to swallow a little bit of it to actually create like a good environment for the acid or whatever is going on with the bacteria problem that you have. It will protect it somewhat. And, this is something that should be used like daily, even before the extractions or anything. I recommend it, especially when a lot of patients would want to come in, because my son, who's 23 years old, he had his 4 molars pulled, and he went to the dentist because he had an infected molar. And you don't want to do any kind of surgeries on something that has an infection already occurring to it. So we did not do any kind of antibiotics. We just used the mouthwash, and I think the infection cleared up within like 3 days. And the dentist then set him up for surgery, and he had no complications at all compared to some of his friends that had complications like the dry socket.
How long should you rinse for each treatment?
I mean, afterwards, I recommend just using the rinse as a daily oral rinse. But afterwards, I believe I was telling him to do it on at least the second day, 3 to 6 times if he had some kind of pain, because it actually helped him even with his pain management, because this is going to help with the anti-inflammatory of the gums and the actual wound. And he wanted to get healed up very fast. So, but anytime, like I would say minimum 2 times a day, but 3 to 6 times a day is fine too as well.
There's a question here, and I know, Dr. Saini, that you answered it earlier, but it might be worth repeating. So will long-term use of H2Ocean disrupt the oral biome?
No, in fact, the long-term use of H2Ocean based mouth rinse, sea salt based mouth rinse definitely builds the quality of the oral microflora. And how it builds it, it will repopulate the growth of good bacteria. In fact, I used to say that this mouthwash works as giving food to your probiotic organisms. So the probiotic, that's the whole, the science behind probiotic is repopulating the good bacteria so that they can dominate the bad bacteria and can naturally suppress the infection and makes the oral cavity, gut health, or whatever the way you are using probiotics maintain its health. And that's how, if you are using H2Ocean based mouthwash, it serves the three purposes. Number one, it will provide all the natural nutrients which is required by the oral mucosa, healing cells, as well as in the saliva that can maintain the good microflora and oral microbiome. Secondly, it contains the lysozyme that will act as a first line of defense in a natural way to prevent any bacterial or anaerobic infections, especially dealing with the red complex such as Prevotella intermedia, Tenarilla forsythia, or Fusobacterium nucleatum. And third, it contains xylitol. And xylitol, as you know, it's an anti-caries effect, and it is a natural sweetener. And the xylitol used in H2Ocean oral care products are coming from the fruits and vegetables, and that also enhance the quality of the product. So it is very much important to understand when we say about ingredients, ingredient is one thing, but what about the source of the ingredient? What about the quality of the ingredient? Where the ingredient is coming from? How the ingredient is processed? And how long the ingredient is kept? What are the working environment for the ingredients? Where it is manufactured? Where it is processed? It's all together. It's a different world when we say ingredients. So definitely the quality assurance of a product depends upon the quality ingredients of the product and how it is processed. And in that scenario, H2Ocean stands out as the gold standard in terms of maintaining those qualities and standard operating procedures.
There is a question here, Eddie, about the sample. Jackie states, trying to get the free sample, but I see a fee if I move forward. If you scroll down to the bottom of the form, there should not be a fee, correct?
No, there's no fee. I think it's only for if you choose to get the 64 ounce, I believe, unless something is gotten with the wrong one.
Yeah. Yeah, 64-ounce bottle is a very big bottle for you have to keep it next to your clinical operatory. So that is chargeable. Other than that, you can get an 8-ounce mouthwash bottle absolutely free to try yourself or to hand over to your patient.
And that should
100%.
last somewhere around probably 2.5, 3 weeks if you're using it twice a day. And you will see the effectiveness. I mean, immediately you're going to feel that your teeth are nice and clean, refreshed. Dry mouth will probably be gone within the first day. So it's very effective and fast acting.
Thank you. So with the tridemic on its way here, whatever we're calling it now, RSV, the flu, and COVID, how do you feel about using this on a daily basis just to try to knock back some of that when you're out in public?
Well, we have
or you're treating your patients.
We have hand sanitizer, we have nasal spray, and we have the mouthwash. I travel a lot, and I'm always bringing these products to actually take care of myself right after I get off the plane so I wouldn't get sick. You know, everyone knows the grandma's home remedy for a sore throat, gargle with salt water. But this is like a very powerful mouthwash, a sea salt rinse, not a regular table salt rinse. So you can imagine how well it's going to work. And also even some of the studies during COVID was saying to use a nasal spray or a mouthwash would help you fight off the flus and COVID viruses.
Got a question here. I work at a community center, and this product sounds amazing, but will not be approved. So I need a good substitution to dry socket paste. That product is no longer available for purchase. So I have managed large community centers. You probably have to go through your procurement department anyways. But any answers to that, Dr. Saini or Eddie?
I mean, one of the key goal of our company is to support these kind of community centers. So please write an email to us, either if you have my email or if you go to the company website, reach out to us. We offer a considerable amount of discount to these kind of hospitals and clinics. Especially, we can provide you a certain amount of samples initially for you to try to your center. And because we guarantee 100% success with our product. So once you feel satisfied, then you can set up an account, a kind of a wholesale professional account with the company where you can get the a good amount of discounts for your center. So please reach out to us, and either to me or to the company email. I mean, if you can share my email address, Dr. Rollins, I'm more than happy to, move those.
Yes, and everyone does have a copy of your presentation, Dr. Saini, in their course folder. We'll bring it back up here.
Okay.
There's Dr. Saini's contact information. Again, you do have a copy of his presentation as well as H2Ocean's in your course folder. A reminder, if you go to the top of the screen, there is a blue banner. You can tap on that banner. It will take you to their landing page to claim free samples, or you can use the QR code in the presentation folder. Any other questions here? Let me scroll back down to the bottom here, Dr. Saini and Eddie.
Mm-hmm.
Well, Jackie, you might want to just reach out directly to H2Ocean again, and they can help you, as Dr. Saini mentioned. Any other questions? Which flavor is most popular?
We did that test through our company, and then we also had an online test before. I mean, it is pretty even. There is, I thought the lemon would be more young people, and some of the mint more for the older, because they're used to the minty Listerines and stuff in the marketplace. But sometimes it just switches, and I like both of them. I think the lemon, of course, is probably better for when you get a sore throat, to fight off a sore throat, because it has a high amount of vitamin C in it. But they do not taste like any kind of sour. It's more of like having something that is minty mojito, but a little sweet to it, not salty. And the Arctic is more of like a refreshing, strong, refreshing aftertaste that lasts a long time. So if you're thinking about bad breath, both of them work great out for bad breath. Cleaning, it's going to clean just as well, both. But, it's just kind of preferred to whatever anybody is thinking, and I would suggest carrying both, because if somebody just doesn't like it because they have some kind of little aftertaste, and it might be because of the toothpaste they use, or something that they don't have something that's compatible. But we are going to make a sea salt toothpaste that's going to be out in the market, hopefully within the next month. It's in kind of production right now. We've been blocked a little bit on getting some of the things filled, but it's on its way. It's a little process.
Question here. I think we answered, the question was in a different form, Teresa, but her question now is it safe for people with iodine allergies?
The iodine is so small amount. It's like a trace in there. So it depends on how much of an iodine allergic reaction they get, because even some of the other ingredients that we had a skin sample test on allergies, toxicology tests done on this, and it shows that it's free of any allergens or free of any toxins. We actually were on Yahoo Health as the overall pick for over 100 different mouthwashes in the marketplace, and we were the #1 overall pick by Yahoo Health. The EWG, which is the Environmental Working Group, also has given us, a safe, very, very, I'd say the #1 or 0 count on any kind of toxins, because they test toxins and poisons in products, if you don't know about that group.
Thank you. All right, I think we've reached the end of our time. Any other questions for Eddie or Dr. Saini? All right, well, please reach out to them both. And again, you have these presentations in your course folder with other handouts regarding the products as well. Eddie and Dr. Saini, thank you so much for being here this evening. We had a great presentation. I think we broke the internet tonight, so you won over the Dodgers.
Yes, thank you so much. It was great questions tonight too, as well. We always enjoy some of these questions, so we encourage you to come out and see us again. We're going to continue supporting the CE Academy. It's a great platform. We encourage you to see some of other Dr. Saini's lectures. I think they're really good, hot topics.
Excellent. And this will be ready for recording tomorrow, so you can refer your colleagues and check every month, because Dr. Saini's live on our platform every month, and also all of the recordings and the upcoming schedules available as well for all of his lectures. So with that, I'll go ahead and post that code one more time for anyone that did not receive it earlier, and that is 329571. Thank you all for being here this evening, and we wish you a good evening. Bye now.
Thank you for having us. Have a good night.
Thank you, Dr.
Good night.
Bye-bye. Good night.
Bye.